I'm Robert Gardner. I'm a Thai massage instructor in Austin. I'm going to show you some work for Corrina's upper back and from the position of lying on her back. Lots of people are having upper back problems because their shoulder blades are rolling forward. So as we stand, as we deal with our daily life using a phone, using a keyboard, we tend to hunch forward. So we're going to show some techniques that you can use to address that. I'm just going to move Corrina's shoulder blades around. I'm looking for movement and also to see how much resistance to movement we have through her shoulder blades, her upper back, her neck. These tiny jostles are just for me to start to see where is movement restricted. You can see just from the shoulder jostle, she's starting to let her arms go. Her neck is easily sliding back and forth. I think she has more issues in her upper back, and part of the way I'm going to address that is to lift her shoulder blade, reach my hand under, and my palm is right next to the spine, right on top of the shoulder blade. So her shoulder blade is sitting in my hand, and I'm pushing my fingers gently into her paraspinal musculature, right along the rhomboids. There are muscles right along the vertebral border of the shoulder blade called the rhomboids. They pull the shoulder blades in. They're often overstretched. I'm just lightly pressing into those. And I'm slowly walking my fingers each time a little higher towards her neck, just gauging where I think it feels tense. As you work on people, you'll begin to notice what feels dense, tense, restricted, and tight, and what feels loose and mobile. You're typically going to work on the former, on that first one where it's dense, tense, and tight. Right there, I think, is a good spot. Now, I have to work my hand, my forearm. I'm starting to feel a little bit of tension in my own hand as I'm pressing. And to minimize that, I'm going to hold this spot. I've relaxed my arm. I'm going to lift her arm. The palm is going to go to the opposite shoulder, and I'm going to use this handle here to gently lean in. And now what I'm doing is I'm bracing this hand and allowing her to rock onto my fingertips. So as I roll her over, she gets a little stretch, then some pressure. A little stretch, then some pressure. If I decide, I can move this shoulder around, even pushing her gently down into my fingers. If I have any doubt as to the pressure, you can always ask the person you're working on. Judging by her facial expression, I say we're fine. Right there. Move my fingers slightly higher, right at that junction between the neck, the upper back. Very tender on most people. 90+% of the population is going to have some problems here. A little bit of tension. Now, holding that spot, this time I'm actually going to lift her whole arm. I'm going to mobilize. I want to see what happens there. Where does it feel like I'm lengthening and having some effect where my fingers are pressing in? I'm going to slide just a little higher. She took a breath. I think that was intense for her. I'm going to lengthen her over. And again, back to the elbow, shoulder blade there. If you're a male working on a female, this is another good tool to use because it allows the female to have her breast tissue covered by her arm and allows you to mobilize the shoulder blade so they feel safe, protected. It allows you to reach back and initiate some movement while they're on their back. My hand got a little tired, so I'm going to take it out. And I'm going to slowly continue that mobilization, giving my hand a rest. I put her arm to the side. Now I'm going to press and and mobilize this way, opening up what is pec and pec minor, pectoralis in the chest. There's a bony knob here called the coracoid process. I believe coracoid in Greek means beak. It actually is a piece of the shoulder blade in the back that comes forward and protrudes out. The pec and pec minor attach on this coracoid process and go down. I'm putting my hand over the shoulder joint and over the coracoid just to lengthen there. You can always compress the arm. And if you decide to press down, you can do that from the side that you're on. Mobilizing the neck, mobilizing the shoulder blade, encouraging them to release and let go. Gonna slide down to the head of the table. Usually I'll have the receiver's hair loose. I prefer this as I find it to be a bit more relaxing for people who tend to tie their hair up because it's in the way, causes some scalp tension. I'm gently mobilizing the head and neck, again, just looking for movement restrictions. I'm going to go right back into that spot, that junction between the upper back and the neck, and I engage a little bit of a slide. In this case, you can do both sides. If they have fabric material, you can try sliding over it. A little tighter on the right side. People who are right-handed tend to be right dominant. They tend to use the right hand, the right leg more. Often I'll work on that side 2 to 1. Twice as much on the right side where it's a little more tense. I get a little more effect, a little more effectiveness out of sessions that way, even to the base of the skull. Because we haven't worked this right side as much, I'm going to reach down. I'm going to lengthen here. So there's holding where her head resting in my palm, and I'm pushing away. It's tractioning all of the muscles that connect in the upper back and go into the head and neck. At the base of the skull, even the trapezius goes up and inserts on the occipital bone, or the occiput, at the base of the skull. You also have a muscle called levator scapula. Lots of massage therapists jokingly call it Darth Levator because everybody seems to have problems right here, all the way up. Layer after layer after layer. Now, a little bit more head mobilization. I'm going very slow here, just seeing what her range of motion is passively with her neck. As I'm moving, I can turn the head to side. Movement. Muscles cause movement, and we use movement to try to figure out what muscles need to be lengthened, massaged, relaxed, a little bit tighter on that side. So I'm going to allow her head to be over. I'm going to gently traction here, and then our old friend. There's a little bit of a glide here. I'm pushing the shoulder blade away. So if I did it without the pressure on the head, you'll see that her head just starts to turn. What I'm doing is isolating. I'm engaging a little bit of slide, but there's a little bit more resistance there. You can see even the skin there, the traction as it lengthens, pulling that taut, giving her some mobility. Reaching down and under, I have the pointer finger and middle finger sliding up along her spine. Right into there. If it ever feels uncomfortable to you as a giver, change it. Figure out a way to work differently. Many massage therapists I talk to are hurting their hands because I think they're not being creative enough. They're not finding a slightly different way to work. And with you at home, you don't have as much muscle strength, so it takes time and practice to build up enough hand, forearm, muscle strength to support the hand and fingers. I'm going to turn her head gently to the opposite side, repeating what we just did. There's that little bit of isolation at the base of the skull, the back of the head, and then slowly right up into the shoulder blade, upper back, neck, trapezius, levator scapula. Now we've worked on both sides. I'm going to slowly see if I can reach in with one hand, support her head with my forearm, reach in with the other. I roll her back to center on my forearms. Now I'm pressing on both sides and gently tractioning up through the upper back, into the neck, right to the base of the skull, and then spreading out across those attachments. You can try and reverse it. And she's on my forearm. The other hand reaches down. She rolls back to center. And slowly, fingers traction up the neck, lengthening the cervical spine. Lots of tension in the neck. Lots of small muscles. I'm going to slowly lift and engage, leading her eye gaze to her left hip. This is going to stretch the right side of her neck. In combination, I'm going to engage that little bit of glide along the paraspinal muscles. This isn't forcing her neck, it's guiding. You don't want to jam the receiver's head forward. You're just going with their own range of motion, their own mobility. You would probably avoid this if the person had herniated discs, neck surgeries. But as long as you go slow and communicate with the receiver, should work fine. Then eye gaze goes to the right hip, this time working the left side of the neck. You're guiding, gliding right along to the base of the skull. And then our old friend on the forearm, back and forth. It gets easier the more you do it. Now the eye gaze is dead center as I lift and roll the head forward. This lengthens the muscles at the posterior neck. Pulling her hair out of the way makes it easier for me to reach in. And again. Right to the base of the skull. Maybe a little movement back and forth. Seeing what her range of motion is. And back down. You can repeat any portion of that until the person goes to sleep, typically. Very few people are not going to love receiving that. Upper back and neck work is probably the main complaint that I see with clients. Lots of small muscles moving the head and neck around. Giving a little bit of attention and detail as we study anatomy, figure out the muscles, the structures we're working on safely. And again, I'm going to roll her head to one side. A little bit of movement there. Traction. If I decided to work on the scalp here, I usually shampoo the scalp. So my fingers are reaching around and through the hair. This isn't so much pulling the hair as it is really pressing the finger pads into the scalp and then rolling gently over them like you're working the scalp, like you were washing hair. All at the back. The thumb is the most versatile. You can kind of move it around depending on how the receiver responds. I can tell she's relaxed. If you're ever wondering if it's too much pressure, usually the receiver will make a grimace, a facial expression. You can just watch for those as you work. And of course, you're always free to ask for verbal feedback. Pull the hair out of the way. I'll gently allow our head to turn to the opposite side, pulling the hair back. And same on the opposite side. If you ever feel like your fingers get tangled, you can gently disengage and then go back in, kind of move them around. Sometimes you get a little hair tangle. But you want to be able to glide the fingers around the scalp easily. Same thing if you ever work on somebody with dreads, dreadlocks, same thing. You go right to the scalp, just work around. And back to center. I'm going to traction through the neck again. She's balanced on my hand or forearm, rolls to center. And a traction up the neck to the base of the skull. Now with the scalp, we're going to work the sides and a little bit to the front. There's a large muscle right here called temporalis. It goes right over your temporal bones, right next to your temples, right? This muscle right here, all of these fibers go down underneath your zygomatic arch and attach on the ramus of the mandible, which means it goes underneath your cheekbone and onto your jaw. People who clench and grind their teeth are going to have lots of tension here. If you know anyone with TMJ dysfunction, this is an excellent spot to work. Also, people with headaches. I'm working across the muscle fibers. Since they feed in this way, it's like I'm going across them, across the grain, right above the ear. If I decide to go a little more with the grain, I tend to live long and prosper and split the fingers right into there. That feels like it's a little dense, a little restricted, so I'm going to place my fingers flat and broad, and I'm going to lean back and traction some of that. Reaching around the ear. Many people hold tension here and have no idea that they do. If you have consistent, constant tension here and don't want to go in for massage, one of the things you can do is go to your hairdresser once a week and just have them shampoo your scalp. Most good hairdressers have a decent scalp massage they incorporate in with a shampoo right in there. You can see me changing the motion and pattern just to work through temporalis there. So, right through the scalp, the temporal muscles. I'm going to start to work the thumbs on top in combination. Again, you want to do this in a way that doesn't hurt your hands. Think about the structures of the hands differently. Instead of just pressing with the fingertips, you can press with the flat fingers. You want it to feel comfortable, easy, and it gets better with practice that I'm sure the receiver will not mind. So, after I've worked through there, I'm going to gently lengthen and traction the neck again. This time just by holding at the base of the skull, maybe over the forehead, a little slide, glide. I can split the hands and slide over the jaw, big, broad, flat palm, up around the temples, in front of the ears. At the forehead, slide gently down. There's a little traction. Then I'll split at the forehead, around the eyebrows, over the temples, and down towards the ears. I'm going to curl my fingers in and reach around to grab onto the ears. Don't leave this part out. I am amazed at the number of people who tell me no one has ever worked on their ears before. The ears are right over the temporal bones. The tissue around the ear attaches to muscle, ligament, tendon, nerve around the head. I'm gently gliding over the earlobes, working my way around with a little traction. I'll get a good thumb grip and lean back and down towards the table, just a traction. You're using the ear as a handle to access the structures around it. I'll traction up and slowly work my fingers just to the lobe with a little pinch and a glide off. Thank you so much for allowing me to share with you today. Thanks again for watching. This is Robert Gardner. You can go to my website at robertgardnerwellness.com. There's a short free workbook you can download there. You have a great day.